Hi, I'm Jason Powers with Legacy Brokers. We're in Lenexa, Kansas, which is part of the Kansas City metropolitan area, and effective tonight, we are on a 30-day stay-at-home order. Last week, we actually asked insurance companies how such an order would impact health insurance coverage for employees of small businesses, and we got varying responses to that question. Some carriers actually pointed to provisions in the policy for administrative leave of absence. Other carriers essentially pointed to the eligibility guidelines stating that employees are only eligible when they're working 30 hours per week or more. So we wanted to make sure that we communicate to everyone out there that it's important that you get the answer to that question from your insurance carrier, taking a look at the policy language. In many cases, what we found is there is some language in summary plan descriptions that allow for coverage to be continued during a temporary leave of absence approved by the employer, in some cases up to 13 weeks. In other cases, there is not language that provides for a continuation of coverage under a leave of absence, and so you have to fall back on the eligibility guidelines for continuation. In some cases, COBRA would apply. So COBRA is a continuation provision that applies to groups of 20 or more employees. If you're a smaller group with less than 20 employees, then state continuation of coverage may apply depending on your state law. If you are in a level-funded plan, COBRA is what would apply if you're over 20, but state continuation may or may not apply depending on how the plan is set up. In level-funded plans, certainly state laws don't generally apply, and that's where you'll want to make sure that you understand what the provisions are for your particular policy. In the event that COBRA or continuation does apply, you'll just need to make sure that you're notifying the carrier of the reduction of hours, which will be the qualifying event for that continuation provision to take effect. In other cases where continuation doesn't apply, for smaller groups with level funded plans, the qualifying event of reduction of hours would actually trigger a special enrollment period in the individual marketplace. And more information is becoming available as fast as this crisis is moving, and insurance companies are responding to it. So as that information becomes available, be sure to check with your particular carrier to make sure that you've got all the pieces in place to continue coverage where necessary. The one big ticket item I think that's coming down is how the premiums will be paid. For a lot of employers, they rely on payroll deductions to capture the employee's share of the premiums, and without having workers come to work, or with workers being on an approved leave without pay, there is the question of how do you capture that employee contribution. Some employers have elected to continue to pay the benefits on behalf of their employees during the leave, and then either electing to try to capture that payroll deduction when employees return to work. Others are electing to just absorb that cost. Certainly that option exists, and that is really an employer question. The insurance companies aren't going to give you a lot of direction with regard to what you should do as a business. So just some food for thought. We wanted to make sure that everybody had that information and is looking at those specific terms for the groups that are out there. So that's we'll keep you updated on our end as more information becomes available. We're praying for all of you to stay safe, stay healthy, and stay home. We'll see you on the other side.